My name is Daniel Matanda. I'm a pre-doctoral fellow in the School for Public Health Research based at the University of Exeter, and I'm stepping in for Chloe today, who convened this series. Chloe is a postdoctoral researcher at the University of Exeter. So I'm very pleased to welcome Joe Langley. Joe is principal investigator, principal research fellow of design research at Sheffield Hallam University. Joe applies design and co-design practices as methods to applied research and knowledge mobilization in the field of health and well-being to reduce inequality and improve the quality of life. So, Joe, over to you. Oh, you're on mute, Joe. Yeah.
I'm still doing that thing.
We all do.
Thanks very much, Daniel. It's a real pleasure to be here, and thanks for the invitation. So, as Daniel said, I'm a design engineer. I've been working in healthcare innovation since about 1999. My very first piece of project as a master's student was working with medical imaging specialists at the hospital here in Sheffield, and taking medical imaging data and incorporating it into engineering simulations in order to look at what brain injuries would result from shaken. So there was a big case in the courts at the time around shaken baby syndrome. And so we were looking at the injuries that would occur when shaking, and we wanted to do it in a sort of virtual simulation and then correlate that with transport research laboratory stuff. So from there, I've got on a very long journey to this current work around using creative methods and practice and participatory creative methods with a real focus on implementation, knowledge mobilization, getting research evidence into practice, into use. So I think that particular journey is probably something that's a subject of another presentation. I won't go into that in too much depth, but I think there's bits of it that are really relevant to how I ended up here. But I want to focus more on where I am now. And I'll start off by sharing with you one example from a study I'm co-director of now with Liz Such from Nottingham University. So about a year ago, we were commissioned by NIHR to be their first ever knowledge mobilization team for the public health research portfolio. Our proposal to them was based on using participatory and creative methods to take evidence from the NIHR public health research portfolio and work with local authorities and other stakeholders to address issues that they highlighted as priorities for them, collate the evidence and help work with them as a way of enabling them to understand what the evidence might mean for them in their context, in their communities. And this is just one example where housing was picked out as a topic by several of the local authority partners we're working with. And within this, we have created a summary that demonstrates and makes an accessible representation of evidence from across various different subjects, because obviously it's a really broad subject area. So if we look in this at, for example, housing standards, all of the evidence that we've reviewed and collated has been summarized into a narrative, into a story about the potential impact of this on real people. There's a link that pulls in what some of the evidence is and where you can go to the source evidence, and then another link that will talk about some of the health outcomes when these recommendations are adopted by local authorities. One of the key things that's come out continuously in our conversations with local authorities is, actually it's going to be two things. Firstly, they have such little time that everything that they do in terms of understanding evidence has to fit on the side of an A4 sheet at the very most, because that's the limits of how they can digest it. Ideally, in more accessible forms than just text. the more it can be about narrative-based forms that fit into an easier to consume in terms of understanding the importance of it and its impact. These are the sorts of forms that fit with their ways of practice and the practical limitations that they have in terms of what they're able to do with consuming evidence and making sense of it. The other big thing that they've also talked to us about is a real dissonance between what's actually done in terms of research and evidence that's produced and what they need. And there's a vast gap. Lots of things to do with really specific interventions, but nothing about how that can be addressed or tailored to their specific context. And there's always, whatever, in terms of specific interventions, it's never, or very rarely, works out as a perfect match or a fit for the different context in which local authorities are working on a daily basis. So that's, I can share the link to this with you, and you can explore this at a later date yourself. But it goes through, and the same sort of picture is, or the same model is adopted for all of these areas of evidence. So it's just an overview. And this is going to be the starting point for us for a co-production, co-design piece of work that we're about to start with 3 different local authorities that's going to dig down into this housing evidence and work out the specific things that we can do at a more practical level to put some of these things into practice with their communities in there. So we're working with 2 county councils and 1 borough council across the country. There's one that's very rural. There's one that's got a huge amount of major transport hubs. And there's one that has massive poverty deprivation. So it's going to be quite varied. And one of our tasks at the end of this is to look at whether there are common themes that we can pull out from this to then share more widely with other local authorities across the country. So that's starting point. But what I want to do is kind of step back from public health specifically and look a little bit more broadly at why creative methods. What is it about creative methods that is more, arguably, in my view, more effective at translating, mobilizing evidence, making evidence more accessible? So what I'm going to do is share a set of slides and workshop that I developed with Ollie Williams to deliver to the NIHR Training Academy around this very topic. And I will drop out of the shared screen a couple of points in time just to share some physical real examples with you as well. So we wanted to start off by getting across this idea that to make evidence work in practice, evidence by itself is not enough. This concept of evidence plus. So there has to be something else besides academic evidence to make things work in practice, in context. We don't live in a scientocracy, and there are many, many factors that shape policy and practice. And unless we move beyond this concept of just putting my evidence out there and it being in isolation by itself, this thing which gets used, we are not going to be successful at our evidence being at least part of how things are shaped in the real world. And we believe passionately and have some anecdotal evidence for that creative methods can be a really effective way of augmenting that evidence to create this plus component and then helping it get into practice. So the main forms of communication that academics are very familiar with and the whole academic system is set up to encourage and motivate and for us to do are those very traditional forms of publications, journals. They only talk to academic audiences. If we're being brutally honest, they talk to no one else. Okay, that's it. So any audience outside of an academic audience, there has to be some other form of communication. That's the starting point. Okay, even academic conference presentations are, again, for an academic audience. And to speak to any other audience, we need other forms of presentation, other forms of communication. And creative forms are where that allows that extra, and that the form of the communication comes down to what are the priority messages. So we go on to different audiences, and again, the messages. Knowing your audience is really, really key. So for academic purposes, there are known audiences. You might have a specific group of healthcare professionals, specific group of patients, families, and also unknown audiences. You might be putting out a general message. Might be putting out a message to the country, or a good example of this might be one of the most successful campaigns that I'm not sure. So It's a Bloody Disgrace was a very successful campaign at helping to eliminate tax on female products. And that was not having a specific audience. That was just about changing social norm of what was acceptable, but it was going out to everyone. Whereas in other cases, there might be, a small group of policymakers, and it might be a really targeted audience. But context is also really important. Where your audience is and what they're doing when they're receiving these messages is crucial. And again, to give you a really concrete example, Ollie was working on a piece of research that had been condensed in one form into a podcast to communicate some things to healthcare professionals. The podcast episode, which contained the really important evidence that they were trying to share, was about 40 minutes long. There were not many people listening to this. What they found out in speaking to those people, that audience, was that if they reduced this podcast to 20 minutes, people would listen to it more, because they had a window of time in moving from one hospital to another that had a 20-minute journey. And that's when they listened to these forms of information. So even little things like that had a massive difference. They reduced their podcast episodes, condensed the information, kept the main headline messages, put it into 20 minutes, and more people listened to that podcast. That's a really simple, practical step about knowing the context in which your audience is consuming those messages. And this can be really relevant for sort of public audiences. Their main forms and channels of communication could be radio. It could be a notice board in a fish and chip shop. It could be any of these things, but knowing where they read or consume or take in that information and what they're doing at that time and what else might be distracting them or drawing on their attention. These are the kinds of things that we need to understand if we're trying to allow people to really absorb the messages we're trying to share. What should be in those messages? So Aristotle and rhetoric defined there as being three necessary components to successful rhetoric: logic, emotion, and morality, or moral argument. Researchers and scientists are typically very good at the logical stuff. They're perhaps shying away from the emotional and the ethical sides of those arguments. We don't want to persuade people to do things based on making them feel guilty, etc., etc. However, we are competing against people, organizations who have no compunction at all about using all three of those. So if we don't use all three of those tools, then we have to be very cognizant of the fact that the messages we're competing with are more likely to win. And again, a really concrete example of this might be, let's see, drugs that are developed to support or aid women going through the menopause. There was a systematic review by a professor from Cambridge recently, which showed that the majority of the drugs that are sold worldwide at billions of turnover a year have very little impact, if any, in terms of helping women going through the menopause. But they have identified a really specific need, and they have marketed this very directly at people, even though it makes no difference to them, marketed it very successfully using logical, ethical, and moral and emotional arguments to say, we will help you with your need. Now, we might disagree with their logic, with their moral arguments and their emotional arguments, but they have done it very successfully. That's what science messages, that's what research messages are competing against. So unless we are prepared to use all three elements and doing it in an ethical and transparent way, so there are ways in which we can use emotional arguments and ethical arguments, which are not about guilt tripping people or gaslighting people or anything, then we should be prepared to do so. These two, the one on the left comes from a piece of work that I did, and the one on the right comes from work that Ollie does. The piece of work on the left, I pulled together a team of people from across the world to co-edit a special issue of Evidence and Policy, where we looked at creative methods in co-production. And across all of the submissions, there were 11 papers finally published in the collection. But across that 11 and some of the other submissions, which were unfortunately rejected in the end, we identified these 10 different characteristics of what the mechanisms, in a sense, of what creative practices and creative methods were enabling. The first four are about enabling contribution. So they enable people to contribute to, in this case, research. It's a more fulfilling process. It's accessible. It creates conditions that are convivial, informal, reducing sort of hierarchies of ivory tower perceptions and so on. And it gives people a form of self-expression. So it's not reliant solely on words. People can use a variety of forms of expression for their experiences, thoughts, ideas, theories, etc. Creative methods also help people to make sense of a topic. So a lot of creative methods include a form of narrative narrative explanations. And narrative forms of thought are more sort of native to real world forms of thinking. That's how we make sense of our lives and how we make sense of the world around us. So presenting research evidence in narrative forms makes it easier for many, many people to assimilate into their wider description of the world and their life and their experiences. It also allows for different perspectives. So there are multiple ways in which, with creative methods, we can actually visualize different perspectives and externalize them. So we can have a disagreement with an external form of a different perspective rather than with another person. So they help us to mitigate disagreement and have a conversation about differences through objects and externally represented difference rather than between people. They also help us with sense making. So the ideas that across multiple forms of creative representative or expressions, we can begin to piece together puzzles. And these 3, 5, 6, and 7, this is one of the areas where I'm really fascinated in this. There's a book by Catherine Montgomery, which is How Doctors Think. And she talks very eloquently about the narrative forms of sense making that clinicians, that doctors use, where they will have fragments of information from different sources, a little bit of patient's history, a few biometric markers they might measure in that time, previous patients they've seen, and kind of different fragments that begin to piece together to make the best fit explanation or narrative of what's going on for that patient at that time. And as they get new information in, another appointment, they might get some test results, they will update that narrative, the best explanation possible. So that kind of idea of piecing things together is how in a kind of real world scenario, when you're not having the luxury of a research process to be able to formulate all of the pieces of evidence, this is how people make sense of the world, and creative methods help to do that. The last set of categories 8 and 10 on this model were about how creative forms of evidence and representations and expressions of evidence allow people to put it into action more easily. So when evidence exists just as words, it's a concept, it's abstract. When evidence exists in a tool, something that people can put into their hands and use, then it's something that is directly embodied. I can use this and make a difference and a change in the world, rather than it just being a concept in my head. This is one of the things where turning evidence from just, and I've got an example of that I'll pull out later on, where I show you how we go from a statistic of 10% through to a tangible representation of what that 10% means, both in images and in a 3D object, and then in an experience for a patient, so that they understand and know, not just as a concept, but through experience, what that 10% number means. Ollie's image on the right here is about understanding an important difference in how creative approaches and methods can be used. So they can be used both as a method to help generate ideas or make sense of data in a topic, and they can also be used to communicate that. In between, there can be creative outputs that can be used for both. But there's also a danger in doing that. And I'll give you a concrete example where at the end of a piece of research, a researcher might approach an artist and say, can you make a creative representation of my data, of my research findings? And the artist will produce something. It's a little bit, they haven't been involved in the research process. Their understanding of that is a little bit secondhand. Their production of whatever's produced is a little bit abstract. And outside of that context, it means nothing to anyone. It's just a picture. It doesn't convey any real meaning, but it looks nice. These are the things where the communication is ineffective. Just making a creative representation of data, of research evidence alone, is not always successful unless it's understanding the medium and the form and who you're communicating to, going back to all those previous points about the audience and so on. And again, I'll hopefully be able to give you some examples of that as we go through. One of the most common things that we get asked to do is to, can you make an infographic of that for me, for my research? Or can you do a comic or a zine? I'll show you an example actually. Give me a second. If any of you are familiar with Ollie Williams' work, I'll just stop sharing briefly. Can you see this? The weight of expectation. Okay, so this is a wonderful summary done. A wonderful summary of Ollie Williams' research. The illustrations are done by an illustrator from Lincoln called Jade Sarson. But there was a really in-depth collaboration between Ollie and Jade in order to get to this point. But based on that, Ollie, for example, has been asked more times than he can count, oh, can you just help me get a comic of my research? This approach really shows the limited understanding that we have as a community around which forms of creative expression are most appropriate for the audience for what we're trying to achieve. Just because that looks good in someone else's project, it should not be assumed that that's the most effective method for you in your evidence in your project. There has to be a critical understanding of which methods work best for which audiences, for which forms of evidence, etc., 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 for what you're trying to achieve. Having said that as well, it's really important to bear in mind that whilst you might have a sense of custodianship over the evidence and maintaining the integrity of it as it goes out into the real world, there's also a natural element where it will be appropriated and it will evolve out there. And holding on to it too tightly will not allow it to get out there at all. Having a sense of it, ownership and giving it to people in a sense that they can adopt it and use it for themselves, and being aware and cognizant of the fact that they will adapt it to their context and it will change once it gets out there, is also a really important part. And creative methods sits in a position where there is a greater degree of flexibility, because it allows that sense of turning it into personal knowledge for those people who are consuming it. So they have more understanding of within themselves, and therefore more likelihood that they will use it. But that also means that there's more likely to be this evolution of it as well. One of the things which we thought it was really important to try to communicate to people as well is that we're not saying in any way, shape or form that you should use creative methods and you should do things that are the most creative. There's a spectrum of possible ways in which research and science can be communicated creatively, and there's no one size fits all. There are really practical constraints, like how much budget you have, like how much time you have, like whether it is a general audience or a specific target audience. These factors should be weighed in terms of your choices of which route you're going to go down. There are two things which we think, the top two, where the more text-based you are, the more it is leaning towards a form of dissemination rather than trying to create impact. If you want to get to something that is more about impact, then moving from a position of telling people what the evidence is to showing people what the evidence is, which is exactly what Jade Sarson and Ollie's comic does. It doesn't tell them, it shows people and allows them to understand for themselves. And again, I'll give you another concrete example of that in just a minute. This is a really important thing that, again, perhaps feels slightly unfamiliar for most academics. We do our research, we have our findings, and it's often, we did X, we found A, B, C, whatever it might be. But moving away from that telling people to showing people, and even enabling people to explore and discover for themselves, are more effective at moving knowledge from my head to be personal knowledge in their head rather than parrot fashion learning. So some examples we say in the room. I'm going to drop out and show you some stuff. So this is an NIHR funded, or was an NIHR funded project that started pre-COVID and then went into COVID. It is being adopted by NHS England, incorporated into their revamped patient safety incident policy, and exists as a set of tools that are now being used in, at the last count, over 20 hospitals across England. The premise of the project is based on serious incident investigations and serious incidents of harm in the NHS. And what we were looking at was how patients and families could be better involved in those processes and the benefits of doing so. We did a literature review, interviewed over 60 odd people, some of them families, some of them patients that had survived harm incidents, families who had experienced bereavement through harm incidents, some staff who had been investigated. That was quite a small proportion, and lots of investigators, including people from HSIB, which is the Health Safety Investigation Branch, the national part of the investigations. They often do maternity cases, and people from NHS England. We also did a documentary analysis of the serious incident policy statements from half the trusts in England. So we had three sources of data: the literature review, the interviews, and the documentary analysis. Once that had all been analysed and synthesised, we had a really clear set of findings, and we were going to step into a co-design process, working with the large majority of those people that we'd interviewed, the 60-odd people, when COVID happened. So we had to move from a face-to-face co-design process to something that was online. The first step of the co-design process that we had prescribed in the application, in the protocol, was a step where we would bring in the evidence from these three sources and the synthesized findings and invite our co-design partners to explore it and understand it. So then they would be able to go into a co-design process, not just using their experiences, but also using their understanding of this evidence to make design decisions about what should and should not be in this revised investigation process and anything to support that. So we had to come up with a different way of being able to communicate this really complex research evidence to this community of co-designers. And within that as well, we had to recognize that many of the people we were working with in this co-design community, this co-design group, had very deeply entrenched views that were untrusting of the NHS, even hostile towards the NHS, and very deeply opposed in their views to some of the other people in the co-design group. So we had a massive kind of task in terms of the relational components of trying to bring people to a position where they could at least appreciate different perspectives within that co-design group, as well as understanding the research evidence. What we did was we turned the research evidence into a narrative. So there's a process called creative nonfiction. So you take the evidence and turn it into an archetypal kind of narrative that you can't recognize any one particular experience or story within that, but it condenses and represents that's not in a scientific way, but represents the findings from across all of those different sources of data. So we had a narrative that was a story of someone entering an elderly hospital ward, experiencing a fall, and then the investigation happening, and then from the evidence, the longer term impacts on all of those stakeholders. We broke that narrative up into different perspectives. So it was a narrative told from the patient's perspective, what they had witnessed and seen and felt and understood, and from the patient's son's perspective, and from the nurse's perspective, and the matron's, and then the institution, the hospital's perspective. And once we'd done that, we fragmented the narrative into a set of cards. So here we have, and it's actually not in the right order, so I need to find card one. So each card takes you through, in this first deck, it's the Datex report. So this is how an investigator would first have their first introduction to a serious incident. And I'll read this one as an example. You are following a serious incident investigation. As you progress, you will find out information which can be added to the timeline. I'll show you that in a second, in front of you. At the end of each deck of cards, you'll be invited to share your thoughts, feelings, and make notes of any questions in an activity book. Card 2. An investigator is first introduced to the events by a serious incident by reading something called a Datex report. This is a digital report completed by a member of staff who was present during the incident. It contains a brief overview of what happened and who was involved. Draw the next card. First, let's see who was present during the incident. So this was sent to people in their homes, all of the co-design partners. And they went through the exercises deliberately set up in this large format. You can see how big it is. And they had to clear a table. The instructions in this say you will need an hour of your time. You need to clear your table. It's trying to create conditions where they're not in front of a computer screen. They're not distracted by other things. They're completely absorbed in this activity. So it focuses them. And again, this is very deliberate design features. And so on this platform, they're introduced to the different hello. They're introduced to the different characters. So there's one there is the patient's son. There's the patient, and they lay them each out on these channels. There's a nurse, and then there's a hospital trust. here. And after that, they continue to take out the other cards from the Datex report and lay them out in the different channels, how they see fit. There's no prescribed order. There's no instruction say this card goes there. They have to reassemble the narrative as best makes sense to them, attributing different cards about the narrative to different characters. And the whole point of this narrative reassembly is that it enables them to make sense of the story better rather than being told. So they're not just being shown the story, they're actually cognitively engaging with it to reassemble it so that it makes more sense to them. Once they've done that with the first deck of cards, deck 2 invites them to become the investigator. So they actually step into this narrative and take on a role. They identify themselves as a particular type of investigator. There are variations, again, drawn from the evidence. We've got ways of defining what the investigator's day job actually is. They're an acute medical registrar, they're a falls coordinator, there might be an orthopedic surgeon, there might be a pharmacist. Different stages, why they're doing it, their motivation. So are they doing it because they want to get promotion? There's someone here who has had a negative experience whilst under investigation, and based on that, she wants to do a better job. That's their motivation for being an investigator. And there are other commitments and priorities. So what else are they competing with for their attention? All of this drawn from the evidence that we've found. So these are ways in which the person using this kit was able to understand all of what we'd distilled from the evidence as competing priorities. Based on how they define themselves, they then get access to a different number of evidence cards. So these are cards which might say, and these were shuffled, and depending on what they dealt with, a different amount of evidence. So patient son, make a phone call. Thanks for calling. It's been a rough time, so good to feel like someone's actually listening. I appreciate the chance to share my thoughts on what we can learn from all of this. There are some which say you attempted to call or contact a person, but there was no response. They were out, they were unable. So it's as real world as possible. At the end of this investigation, they have to make a decision. And again, everything that's in here and what we're trying to reconstruct is based on the evidence. The really interesting thing from a user perspective for this kit is that they can go back and change their definition of the investigator and get new evidence and repeat it and come out with a different result. So they can go through and look at cause and effect. What if I change this? What if I do something different? This goes through a number of different steps, and they repeat the investigation again, different kind of investigator, and then they look at the long-term impacts on all the different characters in this narrative. This was completed by our co-design partners independently at home by themselves before we first came together. It was their way of making sense of the evidence. We had anticipated when they first came together after this point that we would still need a good hour, 2 hours, just to get to know each other and build relationships. We couldn't have been more wrong. Within 5 minutes of coming into this meeting, they were talking to each other about this experience. They were relating, we hadn't even started facilitating the session, and they were talking and sharing. They were sharing some of them before they even got to that session on Twitter. One of them, a family that had experienced bereavement in the mid-Staffordshire events, was talking about it being the first time she'd felt sympathy for staff. Another one talked about it being a really disarming way of enabling them to appreciate the perspective of staff. So before we'd even come together, a lot of the hard work had been done by this kit, this representation of the evidence, in terms of moving people, enabling them to understand different perspectives, putting themselves in other people's shoes, and move from their position to something that was more understanding and holistic of the complexity of what's going on within this specific scenario. Now, this is not a public health incident. This is not a public health piece of research or But the learning from this, for me, is really powerful and really effective about how narrative-based and even physical forms of presenting evidence, interactive forms of presenting evidence, can be really powerful at enabling people to both understand and shift their position in terms of their knowing, their appreciation, their understanding. This whole kit was designed just for that purpose. What we hadn't anticipated was that later on in the co-design work, our co-designers brought this back in completely under their own volition as a tool to use in terms of understanding what could we change to make this different, to get a different outcome. What could we change in this narrative? So again, the narrative-based component had a further an extended kind of value in terms of enabling people to think about how do we change that narrative. It's something, I don't know, called narrative agency or something like that, where it's trying to create a different outcome, but using stories and narrative-based methods to do so. And then again, later on in the co-designed components and outcomes, this feature, again, they asked for this to be reintroduced. One of the components was about training for investigators. And this was used as part of the training resources and training facilities, all of which was initially unintended. There were refinements made. They adapted this, they made it better, but it's still there as a part of the training resources that are provided for investigators now. So that's one example. Another example I'll really quickly give is, how am I doing for time? Sorry.
Yeah, doing okay. I think maybe we can have we can leave maybe on 10 or so minutes for questions, or 5 minutes or so.
I'll do one more example and then we'll move on to some of the other things, because I think there's some kind of concluding messages that perhaps we could take. Thank you, Daniel.
Sure.
So I'll come to that 10% statistic example. So this is, has anyone heard of Pjama paralysis? Pjama paralysis. Okay, so Pjama paralysis is a phenomena that particularly in hospitals on acute elderly wards, when someone is admitted and they're confined to their bed for perhaps 5 days or more, the evidence, the research shows that they will lose 10% of their muscle mass. And obviously that has repercussions afterwards. So if they are 10% loss of muscle mass, there are massive implications, which means that they're more likely to have a fall. It starts a downward spiral of being in hospital, back out in the community, back in hospital, and so on and so on and so on. So big movement to try and reduce immobilization for particularly acute elderly people, but frail people across all ages, when they're admitted to hospital for episodes that might be several days, multiple days. And the thing that they did was they turned it into this, one of the things that they did in one of the hospitals, turn it into this infographic. You know, let's educate staff and let's educate patients themselves and let's educate families, and we'll kind of tell them, you know, if you don't move around, you'll lose 10% of your muscle mass. No effect. Some people were, yeah, lose 10% weight. That's fantastic. And it's kind of complete misunderstanding of what this means and what 10% means. And this is not something we've actually done as an intervention. It's something I sat down with the researchers and did as a thought experiment of what else could we do to show what and make it more relatable to people. The first thing we did was we took sections of people's legs and printed them out and showed them as 10%. So you've got a bit of a scale. What does this mean to my size of my leg? And then we literally, so this is a day's worth of work. We literally printed them out as, so I don't know if you can tell on this. You can see that this one is the full scale, whereas this calf here. And this is where the medium of presenting online loses the effectiveness. So you can't touch and feel these things. But I obviously, that this is a tangible difference in the size and feel of what that is. But that still perhaps doesn't have that, okay, what does it mean for me? What will it do? So then we said, okay, it will mean you have, if you have less strength in your legs, you'll have less, worse proprioception, balance, all of those kind of things. So then we printed these. So these are things you can actually put on your feet and you can walk around and you will wobble. Now, this is not evidence-based. We haven't gone around and said, how much balance will you lose? And let's make this, it's representative of a loss of balance. And the idea that you can go from 10% as a number and concept in your head to something which is an image, you can visualize what 10% difference is, to something you can touch and feel, something you can experience. And the impact that that may have on a person to understand what it means to them, the likely impact on them in their lived experience. And that, with that understanding, is our hypothesis is more likely to persuade someone to change something in terms of their behavior rather than just a number, 10%. So this was, we had people walking around a Leeds conference centre wearing these at the NIHR Training Academy, which was quite fun. Anyway, let's move on to some of the closing messages. I'm going to share my screen again. There are a number of other examples here which are more along the visual forms of sharing evidence. And so this is taken from a particular journal article and it's portraying it through 3 images and frames. But what we're going to get to is that this was an exercise that we could have done if we had a bit of time, if I hadn't waffled for so long, sorry. So there's 6 take-home messages or useful steers that I think it would be valuable to sort of leave you with. So the first is to think about the process, not just the outcome. So this is thinking about it as an integrated thing, not just creative outputs as an add-on at the end of a piece of work, but how you can build them into a process so that the evidence more naturally fits into a creative form. The second is meet the value, needs and requirements for all stakeholders. So that is likely to mean different kinds of outputs and messages for different audiences. And this also goes back to the point about context and knowing your audience. So understanding where they are going to be and what they're going to be doing when they take that message in. The next one is about creating opportunities for people to engage and giving them a reason to. So this is understanding what's important to them, the value to them. And this again goes to the message. For most people outside of academics, they don't really care how we did something. So that's important to academics in terms of the rigor underpinning the evidence. But we always lead with that. Now, that's the most important thing to academics. We go through a long list of method and then go, this is what we found. But for most other people, what we found should be the headline. The how we did it is to many people almost irrelevant. So that hierarchy of messaging for different audiences is really, really, really important. This next one up here, number 4, don't outsource, collaborate. The number of times that I have been asked to do an infographic for someone else's research or evidence, and the process of trying to get something that's meaningful at that stage is far longer than if I had been working with that researcher during their research process. And it's less meaningful than if I had been working with them throughout their research process, because I have a far more implicit understanding of what the evidence is and what it means for different audiences than if I'm just added on as a consultant at the end of the process. Number 5 goes back to my earlier point about being a custodian of the evidence. So there will be some evidence, what we call message plasticity, that it will evolve. Concentrate on the big take-home stuff. Don't sweat the small stuff. It will always evolve. Knowledge always does evolve. Evidence always evolves. It'll always be superseded at some point by something else. It's the sort of compression stockings are the great example. They were huge evidence, and it was held up as a case study that illustrated how slow translation of evidence was into practice for many years. It took so long, so many years to go from, we know compression stockings make a difference and really should be used, to then being used in a widespread way. And then what, 2 years ago, a new study that came out says they make no difference at all. And we've been using them for 20 years. So evidence is always superseded. And this last one, for me, is, I think, one of the most important, because this is the one about really empowering. If we really believe that knowledge is power, telling people what we know, rather than allowing them to come to some kind of knowing, this is enable your audience to understand the concepts. And if they don't understand, it's not because there's a problem with them, it's because we're not showing them in an appropriate way. We're not sharing this evidence in an appropriate form. So this comes down to, again, knowing that audience, knowing their preferences for learning, knowing their values, shifting perspectives, etc., etc., etc. I'm going to finish there because I could bang on about this all day if I was given a chance. But I know that it would be, perhaps people might want to feedback or have some questions. Sorry if I went on for too long.
No, thank you, Joe. There was so much wisdom packed into such a short period of time. We only wish we had more time to go into those activities that you mentioned as well. So thank you again for your talk. Perhaps we have time for one question. I couldn't see any questions in the chat, so I may be selfish and ask my own question. So one thing I was particularly intrigued by was the graphic you showed on pathos, ethos, and logos, and sort of like the different aspects of putting together your research process. So I wondered if you could expand more on finding that right balance between the sort of evidence, the logic, the ethics, and the sort of emotional messaging in matching your method to your aim and your audience. I think there are different bits that you touched on throughout your talk that may sort of allude to that, but I wondered if you could, just speak more towards that, finding that right balance between those circles.
That's a really, really tough question to answer because it's kind of case specific. So with the serious incidents example, for example, taking that one, we were working with people who had experienced trauma, not just once with the loss of a relative, but then secondary harm and tertiary harm when they had gone through investigations which were trying to cover up, and another re-investigation which also tried to cover up. So they'd experienced harm on harm on harm. So there was a really important component of navigating the kind of moral and emotional dimensions of persuasion in that particular case that might not be so present in others. And I think the authenticity of the human, relatable, human-centered narrative in there is something which became the most valuable tool. Because if we just honor the stories that we had been given authentically, then it would instantly resonate with the emotions that people felt and attached to the experiences that they'd had. And I think that's one of the really important sort of strengths of narrative-based work, and particularly when we're addressing things to do with inequalities or harm or stigma. The experiences that people have are embedded with their own sort of emotional content. But if we deviate from that in any way or try to use them in any way to leverage some kind of advantage for ourselves, then instantly we're doing the opposite of what we're trying to achieve. We're putting people off because they will sense the lack of sincerity and authenticity and genuineness in those messages. So for me, I think in those kind of instances, it just sticks to the authenticity with which we are sharing people's stories through these forms, and bearing in mind that this is going back to, it's not a real person story, it's like a creative nonfiction, but it still has to be something that they resonates with what they have lived through. And that, for me, I think that's the biggest thing that I would suggest. And it's how you wrap the sort of evidence around that human-centered story then becomes the sort of component of the logic. And how much of that evidence goes back to the last point that I made there. So sorry, the second point around the message plasticity. and don't sweat the small stuff. You have to have a hierarchy. Within most research studies, there are multiple findings, not just one. But there will be a hierarchy of importance to those. It's like, this is kind of really key thing that we want people to take home, and these are the kind of perhaps less so. So being cognizant of that as the narrative is constructed is a really good way of ensuring that the core kind of take-home messages are always central, woven throughout the narratives that you want people to understand, and the other bits are peppered throughout. But it's not a question I can answer completely, because I think it is A, case specific, and B, that we haven't had a study. So I've just submitted a bid to have a realist study to look at what methods work best for different audiences, for different forms of evidence. Going from, you know, performative pieces where we might use forum theatre as an interactive form of narrative storytelling, through to games and other forms of storytelling for sharing evidence. But one of the kind of key points to answer your question is, I don't know. There are big unknowns about this as well.
Yeah, thank you. And I guess that just highlights how exciting of an area this is in terms of exploring those unknowns and furthering the methodologies that we use to explore these big questions, these complex questions creatively. So we are at time. Apologies that we weren't able to get to more questions. But thank you again, Joe, for speaking with us today. Would you be happy for us to share your contact details if people have questions to reach out to you?
Yeah, of course. And if you want to send me the chat document, then I can do my best to answer some of those questions and send it back to you, and you can share with people as well.
Okay, perfect. We'll do that. Okay, so that concludes today's webinar. Just to say, our next webinar will be next week, at the 26th of February from 12 to 1. We'll be pleased to be joined by Marie Clancy from the University of Exeter, who will be speaking on methodological approaches to using poetry in research with refugee children and their families experiencing palliative care. So hope to see you then. Thanks again, Joe, and we'll see you again soon.
Can I get an invite to the one next week?
Yes, absolutely. We'll make sure that you get that link as well.
Brilliant. Thank you.
Cool. Thank you, everyone.